Thank you for giving me the opportunity to say a few words to you on the occasion of the World Kidney Day on the 10th of March. In respect of what the European Commission is doing at the moment in terms of non-communicable diseases, I'd just like to refer to the overall framework of the Sustainable Development Goals, which is a little bit our guiding lines for working particularly on non-communicable diseases. We have recently launched a new approach within that context, which is called our approach of Healthier Together. The idea is to avoid premature deaths, complementing the work on cancer that we're already doing in the European Cancer Plan. So it's a more general framework which would cover a variety of non-communicable diseases. While focusing on prevention and health promotion, this initiative may also support better knowledge analysis and data gathering and sharing, may support as well things like screening or early detection. It may support issues around diagnosis and better treatment. And of course, there's the issue of quality of life of patients. So we're working with the member state authorities through a specific expert group. And we have also established a process of discussion with our stakeholder community, which would include, a wide definition of stakeholders, organizations such as EKHA or the International Society of Nephrology would be good examples, but there are many more. And we have a sort of a horizontal strand then, which would deal with issues like health determinants in a more general sense. Because many of the health determinants are, of course, common to several diseases. Examples would be issues around tobacco, nutrition, alcohol consumption, physical activity. And as you know, one of the risk factors for chronic kidney disease is diabetes and high blood pressure. And if we focus on the proposed strands, including health determinants, we hope we'll also have a positive effect on kidney disease, in addition to any other conditions which we would be targeting. In addition, we hope that the implementation of this initiative would encourage member states to devise their actions on all non-communicable diseases, especially those that are particularly relevant for a particular country. We work directly with the member state authorities who wish to replicate best practices to tackle these health challenges, including in the area of kidney disease. Indeed, the 2022 work plan of the EU for Health programme includes a call already for collecting and implementing best practices for a variety of non-communicable diseases, and chronic kidney diseases would be included. And I'd encourage colleagues who are watching to consult this call and see if they have something that they would wish to see financially supported. Talking about innovations in treatments, the Commission has been supporting research and innovation through, for example, the Horizon Europe programme, where we had 40 projects with a total of 64 million euros directly addressing chronic kidney disease, and 24 projects for an amount of 47 million addressing kidney transplantation. And just to give you a flavour of the type of projects that we have been funding, we had a randomised controlled phase 2 trial on the personalization of immunosuppression by monitoring viral load post-kidney transplantation with a budget of 6 million, and a consortium for diagnosis and risk stratification in kidney transplant patients with a budget of 6.6 million euros, together with a number of others, for example, concerning stem cell therapy for diabetic kidney disease in a clinical trial, and a new dialysis system that's portable and can be used at home and at work. So you can see there's a whole series of different projects, a rather large number of projects, I would say, from the research program, which I think directly address the needs for innovation in treatment. We also have possibilities in the Horizon Europe program, research program, which brings additional possibilities on prevention, on diagnosis, on early detection, treatment and management. So in addition to all these projects which have already been financed in the past, the current Horizon Europe program is very much open to these types of projects. The European Innovation Council work program for 2021 also included a call on medical technology and devices, and mentioned specifically portable dialysis equipment. So from the point of view of the research program, we fully support the need for additional research, pooling of knowledge to increase the quality of life and life expectancy of chronic kidney disease patients. Now, despite the heavy burden of kidney disease globally, kidney disease is not listed in the top 5 non-communicable diseases, and for some reason there is a question mark over whether kidneys are a vital organ, and that's why we do think that chronic kidney disease is something which can be addressed at the European Union level. And I've given the example of the research program, for example, where substantial investments have been made in this area. In terms of public health, we will be supporting through the Healthier Together project, which I mentioned at the beginning, the identification and rollout, scale-up of best practices. And these could quite easily cover aspects relating to kidney disease. So I would really hope that organizations, patient groups, health professionals would feel it possible to engage with the Commission and the Member States in a discussion on how to include kidney disease as part of this process. So in terms of supporting World Kidney Day 2022, I think it's of the utmost importance that this type of event receives as much support as possible, and that's why I'm very happy to be able to speak to you today in respect of your efforts to raise the profile of kidney disease as a public health issue. I fully support your initiative. I fully support your work, and I really think that there is a lot that we can do together in improving knowledge and action in the area of kidney disease. And in terms of advice on how to deliver better kidney care for everybody, I would say that the impact of COVID-19, which is still continuing, of course, will have major implications for our health systems, particularly in terms of delivery of care to chronic disease patients. And we are looking at the moment to see how health systems can be strengthened. Commission has proposed a number of changes to our legislation, but we have also proposed a substantially increased budget for the EU for Health programme and for the research programme, taking account of the needs of the health systems in building back after the pandemic. So again, thank you for the opportunity to speak to you today, and with my full support for World Kidney Day 2022. Thank you.